Hello students, this is Perio, Chapter 22, Lecture 1, The Concept of Best Practice. Clinical practices, treatments, and interventions that result in the best possible outcome for the patient are considered concepts of best practice. The goals are consistently superior patient outcomes that are measurable and reproducible. The best practice approach to patient care. Direct access to clinical research information such as new techniques, tests, procedures, and products for periodontal care, hundreds of articles published in dentistry annually, and the Internet allows instant access for research results such as PubMed. Practicing hygienists must remain current with new techniques, devices, treatments, materials, and philosophies that will result in improvements in delivering the best possible periodontal care. Dental hygiene is an evolving profession. What was appropriate treatment for optimum care 2 years ago may not reflect the highest standard of care today. Today's patients expect to be active participants concerning their care. Patients may arrive with information obtained from the Internet. Widespread health information from the Internet is available to patients. Not all studies are relevant to clinical care. New does not always mean better. New treatments and products must consistently show a benefit to the patient. Some may be costly to implement. The role of evidence-based care in best practice. The ADHA definition of evidence-based care. Evidence-based healthcare is the conscientious, explicit, and judicious use of current best evidence in care of patients. It incorporates individual clinical experience, patient preferences, and best available evidence. The goal of evidence-based care is to assist the healthcare professionals in applying the most current and best scientific evidence to patient care, to improve health outcomes by closing the gap between what is known, research, versus what is practiced, the care that patients receive in medical and dental offices. The knowledge gap. Studies of the appropriateness of dental hygiene care show that there's a gap between what is known to be best practice and the care that patients actually receive. We've discussed this several times in class regarding how patients were diagnosed by looking at the appearance of the tissue only without x-rays and without probing. Studies on hygienists' knowledge and practices relating to caries prevention showed variation in knowledge and practices. Studies found that the longer healthcare providers were out of school, the less current their knowledge was. 3 foundational elements of evidence-based care: incorporation of the best scientific evidence, the healthcare provider's clinical expertise, and the patient's preferences and values. This is an image that shows the overlap of these 3 factors. In 1998, about 10,000 journal articles were published in English. It is not surprising that busy healthcare providers find it difficult to keep up with the current research. Levels of evidence is a ranking system used in evidence-based care to describe the strength of the results in a clinical trial or research study. The higher the level of evidence, the better the quality. The lower the level of evidence, the greater the bias. Let's discuss this for a moment. This pyramid is illustrated on page 371 of your book, figure 22.2. It points out that expert opinion is the lowest level of evidence, whereas systematic reviews are the highest level. This is why we run into issues with conflicting information in different textbooks, because the expert opinions are not based on systematic reviews. Systematic review is a concise summary of individual research studies on a dental treatment or device to determine the overall validity and clinical applicability of that treatment or device. Best practice. Clinical practices, treatments, and interventions that result in the best possible outcome for the patient. Practicing hygienists must remain current with new techniques, devices, treatments, materials, and philosophies that will result in improvements in delivering the best possible periodontal care. The goal of evidence-based care is to assist healthcare professionals in applying the most current and best scientific evidence to patient care, as opposed to popular opinion or the opinion of experts, who may be completely wrong. Studies found that the longer healthcare providers were out of school, the less current their knowledge was. That is because they were not doing enough continuing education in live lecture settings at locations where research was being done, such as dental schools that have research programs. Systematic review is a concise summary of individual research studies on a dental treatment or device to determine the overall validity and clinical applicability of that treatment or device. Formulating a question. A clinical question may develop from questions that arise relative to patient care or from an area in which the hygienist wants updated knowledge. It involves converting problems into answerable questions. The four components to structure a question. P stands for patient or problem. Example, a periodontal patient with bleeding and gingivitis. I stands for intervention. Example, brushing and daily home irrigation. C stands for comparison. Example, compared to brushing and flossing. O stands for outcome. Example, reduced gingivitis and bleeding within 4 weeks. Here's an example of the formulated question. For a periodontal maintenance patient with bleeding and gingivitis, will brushing and daily home irrigation or brushing and flossing provide a better reduction in bleeding and gingivitis within 4 weeks? The PICO process. This method of formulating a question is called the PICO process. Page 372, figure 22.3 shows more information about the PICO process. Resources for systematic reviews. Websites: the TRIP database, Cochrane Collaboration, PubMed, and the American Dental Association. Finding clinically relevant information. The PICO process is a tool for formulating a question. Resources for systematic reviews include the following. This concludes Perio, Chapter 22, Lecture 1.